sí, 3, 2, 1.
Hey everyone, and welcome to Tuesday Tips. I am Dr. Vidal, and this is our weekly check-in. We go over different topics in plastic surgery, and I get to answer your questions. Thank you so much for the love, for logging in, for watching the videos, and for the comments. Love it. Today we're going to be talking about Mommy Makeover recovery because this month we've been talking about tummy tucks and mommy makeovers because we have a special. So you guys should take advantage of this because this is ending July 31st. That if you're booked with us a tummy tuck or a mommy makeover this month, you get the Expril shot for free. If you don't know what Expril is, check my live from 2 weeks ago that I talked about what Expril is. They're basically a pain medication shot that we give intra. It is very good. And this week, we have a flash sale that it's not only the Expril, but we include 3 massages. We include a post-op kit that includes an extra binder and belly button shaper. What is all of that? Let's talk about Mommy Makeover recovery. So Mommy Makeover is basically a combination of a breast procedure and a tummy tuck. So a breast procedure can be a breast lift with or without implants, can be a breast augmentation, it can be a breast reduction. So anything that the patient really needs in combination with a tummy tuck. And why it's called a Mommy Makeover? Because it's the areas that with pregnancy usually get altered and usually need an improvement. So that's why we call it the Mommy Makeover. So in the recovery, obviously it'll include parts of the breast and parts of the tummy. So let's start with when you wake up from surgery, what are you gonna have on? So basically you're gonna have a surgical bra on that I'm gonna fit for you after I finish the procedure. And that's why I don't recommend anyone buying any surgical bras or anything before the surgery. You don't know what cup size you're gonna end up with. It all depends on if you're getting implants, if you're not getting implants, if it's a reduction, if it's just a lift. So I don't recommend you buying any of these garments beforehand, okay? I'm gonna put that surgical bra, fit it for you in the operating room. If, for example, if it's a breast reduction, I don't want anything too tight because we can end up having problems with nipple necrosis. We don't want too much tension on that breast. If we're doing a breast augmentation, I want it very tight. I'm not changing the nipple position and I want to avoid bleeding around that implant. So I'm gonna fit it for you depending on what surgery you're having, the best that you need. And that surgical bra you're gonna wear for the first week. There's no need to change it or to buy another one for that first week. But what if it gets dirty? You can take it off and wash it for 30 minutes, an hour. Plan it for when you are showering, you're getting your massage, and you can wash that garment while you are doing your shower, your massage, and then put it back on. After I see you the first week, you can continue to use that surgical bra, or you can switch it to a sports bra after 2 weeks. But a sports bra that has support, okay? The important thing with this garment is that you're supporting your breast, that the breasts are not putting tension and pressure on the incisions. So you want something that gives support. So if you decide to switch to a sports bra, that's fine, but don't get those like super stretchy, thin cotton ones that don't give any support. I want it to be supported, okay? The other thing that I usually hear from my patients is, I don't want the incision or the edge of the bra to be rubbing in the incision. There's sports bras that the band of compression is more in the chest, okay, and not directly on the incision. So look for those that the bottom part of the bra is a little wider, so it's more in the chest wall and it's not like giving like a compression or tightening on the incision. And you're gonna be wearing a sports bra or a support bra for 6 weeks at all times. Yes, that means at night too. You're gonna be sleeping with a bra for 6 weeks, okay? The reason for it is we don't want, especially with an implant, we want that capsule. The capsule of the implant always happens. Everyone has if you have an implant, you have a capsule, okay? And that's good because that capsule keeps the implant in place. If you've seen patients or if you've experienced when you lay down that the implants go to the sides, that means that the capsule is too stretched out. That means that initially there was a lot of movement with that implant. We don't want the implant to move much, okay? That shearing effect or that movement effect is gonna cause that capsule to stretch so far out that then it's gonna be very mobile. We want those implants to stay very perky and where we want them. And that is the reason why you should be wearing that support bra, compression wise, not super tight, but compressed, that it's giving support for 6 weeks, okay? In the abdomen, we are going to transition from 2 different types of support, okay? The first one, it's called an abdominal binder. So a binder is an elastic wrap, okay? And it has a Velcro. And the reason for this is because you're going to have 2 drains. So where do you put the binder? This is a very common question. So the incision, let's just, for demonstration purposes, the incision is where this band is. The binder should be just over that. The binder should be covering the incision. You shouldn't have the binder too high and then the incision underneath. No, you want that binder, the edge of the binder, just below where the incision is, okay? We want that. When I do liposuction all the waist and also this lower part, so you have a good transition from the waist to the hips, okay? Looks like an hourglass. If you put this too high, then this area is not gonna get good compression and the hip's gonna look too high, okay? So when you put the binder, you want it just the edge, just below the scar. How tight? This is a very common question. You want it tight enough that you give it a little bit of a snug, okay? That gives good compression. You don't have to go all the way like this. That is too tight, okay? That puts too much tension on the incision. We can have problems with skin necrosis. So tight enough, a little pull, and then close it, okay? Tight enough that it's snug, but you don't have to go crazy at it. That's actually not beneficial, not good for your skin, okay? Why do you have a binder and not a faha initially? Because you're gonna have 2 drains coming out of the corners here, okay? If you have a faha, you're not gonna be able to have exit the drains comfortably, okay? So you're gonna have 1 on each side coming right here, okay? The binder, you keep it for 2 to 3 weeks, the same time that the drains are in. Once both drains are out, that's when you can switch to a faha. Common question, stage 1 or stage 2 faha? Well, if you are one of those lucky ones that the drain stays for 1 week only, then you should transition to a stage 1 at first. After 2 to 3 weeks, if your drains were in, the majority of patients keep their drains for 2 to 3 weeks. If that's the time frame, then you can switch to a stage 2 at that point. Okay, so after 2 to 3 weeks, it's good to switch to a stage 2. If the drains were removed before that, then in the meantime, stage 1 to protect the skin. Okay. And this is how the drain looks, okay? This is called a JP drain. Jackson Pratt, the person that invented this, JP. And this white part is gonna be on the inside of the skin, so you're not gonna see this part. And you see that it has these little holes to collect the fluid. And then this is what exits through the skin, okay? This is gonna be attached with a black stitch. That's the only stitch that we need to remove before removing the drain. The rest of the stitches are going to be internal. No need to remove other stitches except the black one that is holding the drain. Very, very important that when you remove it, you remove the entire string of black stitch. That stitch is not absorbable, so if you leave it there, you're going to have a black string of stitch there because your body's not going to absorb it, okay? So that's going to be exiting through the corner. They come with this little clip, okay? So usually what you're gonna do is you're gonna clip it in the bottom edge of the binder, and that way the drain is not like flipping around, okay? And how do you empty it is very, very easy, okay? The only 2 things that you really need to do with the drain is one thing that's called milking the drain, which basically it's kind of like avoiding clots or thicker stuff to accumulate in the drain that causes obstruction. The easiest way to do this is to put hand sanitizer in the hand that you're going to do it, so it's a little slippery, not the one that you're holding the drain with. The drain is here. Hold it tight, and then with the slippery one, you milk the drain like this. and then you're gonna hold it closer with the non-dominant hand and then strip it again. And you keep on doing that movement until you reach the end of the string. That's where the drain is, okay? You need to do that maybe once or twice a day. I've had a patient once that broke a drain because she was doing this every 10 minutes. You don't need to do that. This is plastic, so if you pull it, you will break it. It's okay to do it just once, maybe twice a day, and that's enough. And then the drain, how to empty it. That's the only thing that you need to do with the drain. Milk it maybe once a day and then empty it. How often? The first day after surgery, you'll have to empty it more often, maybe 2 or 3 times in a day. Later on, when it starts to slow down the output, maybe once a day is enough, okay? What we don't want, the drain works by negative pressure. So it has this little tab, you open it, you compress the bulb and tap it. And if it's like this, right, collapse, that's how it's suctioning. That's the pressure that it's suctioning. When it starts to fill out with fluid, it starts to get more rounder. We don't want the ball to be completely round, because if it is, then it's not suctioning, okay? So if it's starting to get round, then empty it. There's no need to be measuring the drain output the first few days after surgery. It's gonna be a lot. It doesn't matter. When does it matter? When it's so little output that it's less than 25 cc's in 24 hours. So you see, there's little numbers here, and that's milliliters or cc's. And the last line, it's 25 cc's. When that, and you measure it with it open, okay? So you open it, you see how much it is. If you're emptying and you're emptying this amount, less than 25, then don't empty it for 24 hours and see how much it accumulates. If it's less than 25 in 24-hour period in a whole day, then it's ready to be removed, okay? How do you remove it? We have a good video on how to remove it, but it's very easy. I told you guys that it had a black stitch holding it on the edge of it. So you're gonna cut that, open the tab, and gently pull it. And you're like, oh my God, it's gonna be very painful. It's not. You're from the surgery, everything is kind of numb. Your nerve endings have been traumatized from the cutting and pulling. So all of that area is numb from the surgery. So this pulling, sometimes people describe it as like a feeling, like, oh, I felt like something like crawled or something inside, but not like pain. So you don't have to worry about that. And gently, you don't have to kind of pull it or jank at it. No, very gently pull at it, and that's it. Okay, usually 2 to 3 weeks. So once that is done, the 2 to 3 weeks with drains, you switch to a faha until 6 weeks out, okay? What about massages? Massages are extremely, extremely important. They're called lymphatic drainage massages because it's all that lymphatic fluid, which is the fluid that we have in our body, accumulates in the areas, especially liposuction, and on the incisions or underneath the incisions. Remember that with a tummy tuck, the skin and fat is elevated from the muscle, so I can do the muscle repair. And all that space needs to adhere and collapse, okay? The drains are helping with the negative pressure to kind of seal everything in. And the first 2 weeks is not good to do any massages in the center of the belly or over the incisions, okay? So this area here is no good, not massages for the first 2 weeks. So the massages are gonna be in the areas of liposuction. They can massage the back and stimulate the lymph nodes, which are in the inguinal area and the axillary area. Other than that, no massages to the center or areas of incisions for 2 weeks. 2 weeks, they can start massaging the belly, areas of incision, the center. I recommend around 10 in the entire post-op course. Everybody's different, okay? Especially massive weight loss patients have a higher risk of seroma or fluid accumulation, okay? So if you're a massive weight loss patient, maybe be prepared that the drains stay a little bit longer and that you may need more massages, more than 10, okay? The first 5 should be every day after the surgery, okay? I'm gonna see you post-op day 5 here in the office. So plan for having a massage post-op day 1, which means next day of surgery, and then every day until your follow-up appointment, okay? After those 5 in a row, usually you can go back home and then start them every other day. I do recommend to get one the day that you get home. It is very common that with the flight, all of that, changes in pressure, you get very swollen, okay? So plan ahead to when you get home, try to get a massage that day or the next morning because you're gonna be very swollen, okay? And then every other day until you reach 10, okay? Hydration. This is these two are the most important things in the recovery of a mommy makeover, okay? Hydrating is key to promote good circulation. Have good circulation to the areas that we want to heal, the nipple, the areas of the tummy tuck which are in the incisions. All those areas need good blood supply. And if we're not very well hydrated, the blood doesn't circulate properly and we may end up with wound healing problems and all those things that we want to avoid. How much fluid? At least a gallon of fluid a day. That's a lot of fluid. And it's not that you're gonna sit down and drink 1 gallon in the morning. It's that you are gonna be sipping fluid during the entire day. And that is one of the things that the caretaker or the person that's with you can help out the most. It is something that is very, people think just drink water and that's it. But when you're in pain, when you're recovering, you're sleepy, you're not thinking about getting up and getting more water. But if you have this tumbler or this water that glass next to you and your caretaker keeps on filling it, then you have that tendency to keep on sipping, okay? And that's key, okay? Mainly water, but also electrolyte drinks help a lot. A lot of my patients then drink a gallon of water, and what happens? The electrolytes go down, and they may start feeling signs and symptoms of low electrolytes like calcium, potassium. What is that? Tingling around the mouth, tingling in the hands, cramps in your legs. That means that the electrolytes are low. Get more Gatorade, Pedialyte in you, okay? The other thing that helps is pineapple juice. Pineapple has bromelain in it that decreases swelling and helps with the recovery, okay? And the other important thing is avoiding blood clots, okay? When we're doing a tummy tuck, the risk of blood clots is higher than other procedures because of the nature of the procedure. Everything is tightening the core, which means that there's more resistance for the circulation for the blood to go back to the heart. When we walk, the calf muscles pump our blood. So that is why it's so important to get up and walk, and that starts the day of surgery, okay? Day of surgery, not the next day, the day of surgery. Once the anesthesia wears off, you're more awake, you start walking, and that's every hour for 10 minutes. That's the second thing that the caretaker is gonna help you with. Keep track of that because you're gonna be in pain, you're gonna be tired, you're not gonna want to walk. Your caretaker is gonna be like, hey, you walked an hour ago, we need to walk a little bit, let's go. And that is why the caretaker needs to be on top of this too, okay? Very important. Compression socks, we're gonna give them to you the day of surgery. If you wanna bring extra ones, that is something that I recommend buying ahead of time. You can find it on Amazon, compression socks, any color or brand, whatever you like, but compression socks, you're gonna be wearing them for a week. And the Venom Pro, you're gonna have it in your quote. It's a device that you wrap around your legs and massages the legs, inflates and deflates. You're gonna be wearing that whenever you're not walking, for sleeping, resting during the day. If you're flying back home, fly back home. If you're driving back home more than 2 hours, you should be wearing it. And also that you are gonna have to wear it for 2 weeks. I don't put every patient for Mommy Makeover on blood thinners. It's called Lovenox. But if your BMI is more than 30, I'm gonna put you on Lovenox, and that's for 2 weeks. It's an injection that puts you that you give to yourself in the thigh, and that starts the night of surgery. So the night just after the surgery that night. Okay, and that is the first week. But the other milestone that you're gonna get is at 2 weeks post-op, that you're gonna remove all the steri-strip or all the tapes that you have over the incisions, and you can start your scar treatment. I recommend silicone-based scar products like Silogen is very good, and a shaper. What is that? So basically, Silogen has a great belly button shaper, and it's the one that's included in your post-op kit if you're booking for your surgery this week. It looks like a marble, but it's not hard as a marble. So one of the things that you can use is a marble, but sometimes it's too hard and it macerates the skin. This one is made of silicone, so it's soft. You can see how I'm squishing it, but it's not that soft like an implant that loses its shape. No, it's soft, that it's gentle on your skin, but it's still firmer than an implant to give the shape, because we don't want something that squishy that it's not keeping the shape of the belly button. So this one, I think it's one of the best. The plugs, the problem with the plugs that you see on Amazon is that the inner part is thinner and then the outer part is very thick, and that macerates the skin and causes more scarring because it puts pressure on the scar that's around the belly button. So I think this one is the best. I recommend it for all my patients. So you started 2 weeks after surgery. I recommend wearing it for at least 3 months, okay? And that is pretty much everything on the recovery. There's one thing that I didn't mention about the belly button, is the only thing that you're gonna have to do wound care wise. I talked about the drains. The other thing is cleaning your belly button. So the belly button, you're gonna have a yellow gauze in it that you're gonna remove the next day, and you can start cleaning the belly button with a Q-tip. Let me see if I have it. So you can, a Q-tip, you can find it in the pharmacy. But basically you want to gently clean like the incision. It's probably, it can accumulate like dry blood and it forms little scabs. So you put hydrogen peroxide and gently clean that edge of the scar. And then another Q-tip with a little bit of mupirocin, the same antibiotic ointment that I'm gonna prescribe before your surgery to put in your nose to decrease risk of infections. That same antibiotic ointment, you're gonna put it and gently apply it over the scar. And you're gonna do the hydrogen peroxide only for 5 days, okay? So after I see you on the follow-up, if everything looks good, you're just gonna reapply the mupirocin, no more hydrogen peroxide. Just shower, pat dry, and mupirocin until the 2 weeks out that you can start belly button training. Very important that incisions and belly button need to be fully healed for you to start this. If you have any wound healing problems, anything opens up, then you have to wait until that heals to apply the scar treatment, okay? It's scar, it's not wound treatment, it's scar. We want a scar, okay, to treat it. Okay guys, I'll take some questions now.
Just a few.
Okay.
We're on time.
Okay.
Okay.
We're good. We'll take questions.
Tuve una reparación de hernia de ombligo. ¿Puedo pensar en un tummy tuck o una lipo?
Sí, todo va a depender del tipo de reparación que se te hizo y el tipo de cicatriz que tenga. Tengo que evaluar tu caso en particular, pero no debe haber problema.
Okay. Is debulking the fat from the thighs a good idea before a thigh lift? What type of thigh lift you do?
Okay, so debulking the fat, it's a very good idea if you have lymphedema. So it's a lymphatic accumulation in the legs, and lipedema, which is that fat becomes thicker and larger. If that's the case, it is good to debulk it before. If you have a lot of loose skin, sometimes it's not. So it depends on the case. And types of thigh lifts, we really have two. The crescent thigh lift with the incision hidden in the groin, which basically pulls up, and it's great for patients that only have loose skin in the upper inner thigh. And the more extended or complete thigh lift, which has that scar and also a scar that goes from the groin down to the knee in the inner aspect of the thigh. That's great for like massive weight loss patients that have a lot of excess skin in the center and distal thigh as well, which is not going to get very good pull with only the crescent thigh.
Dr. Garrett Wigriff, it's live here.
What's up?
Bro. Okay, do I have to quit smoking before surgery?
Yes, 100%. So nicotine causes vasoconstriction. So it kind of shrinks the blood vessels, which then decreases the blood supply to the areas that we want to. Surgery itself causes vasoconstriction. So on top of that, you have nicotine affecting wound healing. the risk of necrosis, wound healing problems, infections is a lot higher. So I recommend that you stop all nicotine products, and it's not only cigarettes. A lot of vapes and other products have nicotine in it. So you have to stop all nicotine products for 30 days before the surgery and at least 30 days after. If you have any wound healing problems, you can't restart the nicotine products until everything is fully healed, okay? I recommend the best thing 2 months before the surgery, and that is to decrease pulmonary complications. With cigarettes, it's not only wound healing, we have lung issues too that can be exacerbated with anesthesia, general anesthesia. So it's better that you stop 2 months before, and the risk of having lung issues after surgery is less.
Oh. Okay, after lipo, how long are you at risk of developing fibrosis, and how you treat it if you get it?
So fibrosis is something that you're not going to see right away. Fibrosis is scar tissue that forms in the areas of liposuction. So you're not going to see it really in the first 6 weeks. It's something that you may start seeing at 6 weeks or later. And it's really that first year. If you didn't develop any fibrosis that first year, basically the first 6 months, but maybe a little bit later for some people, you're really not at risk after that.
Okay. Do you recommend IV therapy a week before? I guess it's before surgery.
Yeah.
A week before.
So, I mean, it is not something that you need, but you could do. IV therapy has been expanding this last few years, and we're knowing more and more of the benefits of it. I always tell my patients that, remember, IV is any IV treatment, you get it fast, but your body metabolizes and excretes it fast too, okay? So keep that in mind when preparing for surgery. I put you in pill supplements, iron, folic acid, vitamin C, in that 30 days before the surgery. If you want to get like a booster of those supplements a week before, I think it's a good idea. I don't think that you need it or that it's required, but it's not going to hurt you. But I still need you to take the supplements pill-wise per mouth 30 days before the surgery. You shouldn't kind of do one or the other. If you decide to do the IV, you do it on top of your supplements that you're taking for the surgery. And that's the same thing after the surgery. If you want to get an IV for recovery after, I'm all for it. Good, you can. You still need to drink the gallon of fluid a day, okay? It's not that you're going to get the IV and you're going to stop the drinking. Because you're getting IV, you feel well faster, but you're going to pee it faster too. So all that fluid is going to go through your body just faster than if you drink it.
When can I resume Ozempic for diabetics after a tummy tuck?
So Ozempic, if you're using it for diabetic treatment and it's not restricting your calories, I'm okay when you start it 48 hours after surgery. But if something that you use for both calorie restriction and your blood sugar control, you may be a candidate to discuss with your primary care to adjust the dose for the first 30 days after surgery. What I don't want is you eating less. I want you eating the right amount of calories so you heal from surgery, okay? So it is something we can discuss with your primary care to see if you're getting both of those effects of the Ozempic or semaglutide is weight loss and sugar control. Maybe we can adjust it for the 30 days after the surgery so you are not calorie depleting after surgery.
And the last one, Dr. V, I had a tummy tuck, but I still have loose skin above my belly button.
Above your belly button, okay?
Above, yeah.
Okay.
Will Lipo 360 make it worse?
It may. It depends on your particular case. When I see that, basically, two main reasons why you may have loose skin. Maybe you lost more weight after your tummy tuck and you have more loose skin, or you have what's called vertical axis skin. So a tummy tuck takes care of the horizontal axis, pulling it down. But if you, for example, are massive weight loss and had excess skin not only in the horizontal plane but also in the vertical plane, you can pull it in this direction, you may need a fleur-de-lis tummy tuck, which gets rid of that excess skin in the center as well, and not just pulling it down. It pulls down and also gets rid of the center skin. It does leave a scar in the midline, but it is a possibility for patients that have skin excess in the center of the belly that cannot be taken care of just by pulling it down. If you lost more weight, or if you just have that without that much, then maybe a revision of that tummy tuck, pulling it down more, will help. But it depends on your particular case. Okay, you guys, I hope you guys enjoyed this Mommy Makeover recovery session, talking a little bit about what are the things that you are going to have in that initial 2 weeks, to prepare mentally and to kind of understand how the drain works, the compression works, and all of it. This is going to be in my Instagram, also YouTube channel for you guys to review later on if it's closer to your surgery day. You can show it to your caretakers as well. That's going to help them kind of understand the process. If you guys have any questions, please put them in the comments or send me DMs. I'll gladly answer them. And if not, I'll see you guys next Tuesday on Tuesday Tips. Take care.
And I have the topic.
Okay, what are we
We're
talking
gonna
about?
be talking about the pre-op for the mommy makeover,
So-
because we have a lot of questions about that.
Pre-op. Okay.
Like 7.
Okay. Willie already has the topic, and I'm all for it. We're gonna be talking about pre-op. We talked about day of and after, but I'm talking before the mommy makeover, how to prepare. Okay, so stay tuned for next week. I'll see you guys next week.